My name is Richard Vinroot, and I'm the Vice President and Global Medical Director of Freeport McMoran. Most of what I do is to oversee our medical assets and make sure we have good medical care in the field at each of our sites. I do believe a healthier workforce is a safer workforce. This is a company that cares about its people and it cares about their health and their medical well-being. We owe our folks more than a paycheck. We owe them good information and ensure that they have a good, happy, healthy life. And I'd always wanted to be a doctor, and I went to the University of North Carolina at Chapel Hill for medical school and a master's in public health. I worked in rural ERs, I worked in urban ERs in the middle of the night. I worked in ERs where I was the only doctor in the whole hospital and sometimes the whole town.
Hurricane Katrina, still a major hurricane.
When I was in New Orleans, I was one of the unfortunate or fortunate doctors to be stuck in one of those hospitals during the flooding and during the hurricane. And I think it altered my career, and I realized that disaster medicine, humanitarian medicine, and would be potentially places where I might be valuable. And so I moved to Africa and started to work for Doctors Without Borders. And at 43, I decided to join the military. Why did I do that? Well, I grew up in a family that felt like it was important to serve your country. My great-grandfather, he was a physician and volunteered and served in World War I. My grandfather, he volunteered and served in the Pacific during World War II. My father was 6'8", he was exempt from the draft, and he too had his waiver reversed and served for a year in Vietnam. Medicine was in the family, but more importantly, military was in the family. So I volunteered for the Navy. I then volunteered basically to go to either Iraq or Afghanistan. They chose to send me to Afghanistan, and it was a very, very rewarding part of my life. But years ago, I had spoken to our previous medical director. He had been the doctor at Freeport for 30-something years. He called me up and said, "I'm actually now thinking about retiring. Would you consider being my replacement?" And I think all these things that I did, military, humanitarian, international, industrial medicine, made me probably a decent candidate. And it's been the greatest decision I've ever had in my life. This is the kind of company you want to work for.